blood pressure, dyslipidemia, abnormal glucose metabolism, diabetes, all these sort of problems which are prevalent here and lead to heart disease. And so high waist circumference is one of the main predictors of the metabolic syndrome. And this shows that the metabolic syndrome gets commoner with age. And so is there anything you can do about it? We've done some studies in our large South Asian population of women in Glasgow. Most of the studies have been done in men. And so there's very little information about women, but we were absolutely amazed when we started our trial. The women came forward in large numbers to be recruited. And we did a sort of 20,000-mile service. We looked at the cardiovascular system, we assessed their diet, we assessed exercise. And this is just to show you that South Asian women in the main, and this is objectively assessed physical activity, the South Asians, when you assess it objectively, really do very little exercise at all. And they also tend to sit around more, as you can see in this slide. These are on the left-hand bar here. They sit around more than Europeans. But when you actually ask them in a questionnaire, you don't get that impression at all. So it's worth, if you can, assessing things objectively and encouraging people to take more exercise, even if it's only fairly moderate, walking, rather than doing anything like going to a gym, which I think many of us are horrified with the idea of. So think about physical activity and, of course, giving tremendous attention to diet. I'm not going to go into the dietary findings here because I think it would take too long. But what would be really interesting is to compare our findings with a cohort that is present in India itself, and I'm hoping to do that someday. And this is the moderate to vigorous physical activity, pre, peri, and post in our South Asians and Europeans, and it lessens in both, which I think is probably no surprise to those who are that age in this room. So I say to my patients, you must use more energy than you take in. And so if you don't take much exercise or use much energy, you must eat less if you want to lose weight. Some of the races are far more sensitive to weight gain, as we know, and the HbA1c increases with increasing BMI, and so the diabetes increases. And this image shows that actually HbA1c is an incredibly important factor, indicator of diabetes control, but it's a very, very important factor in South Asians, much, much more so than Europeans. And it's determined by age, about which you can do nothing, and then diet and exercise. So you can help your patients with simple means. But I want to really finish with putting in a plug for screening. And I know people here may well be screened, but screening for the whole population. In the UK, we have screening for all for breast cancer and screening for all for cervical cancer. And I just want to show some figures as to why that is important. And these are figures for different countries. And India and breast cancer. The results here, I have to say, are really pretty bad. They're worse than other countries in this part of the world, Europe aside. And so many of these cancers could be picked up by screening, and I don't just mean mammography. Self-examination of the breast, examining breasts when you see patients in clinic. And I would really urge you to try and raise the concept of breast awareness with your patients when you see them, because it is so incredibly important. And this is the age of peak incidence, which we've got figures for India here, and it rises as people go through the menopause. So, critical age for it. The other thing where India feature pretty badly are deaths from cervical cancer. The first time I came to this part of the world and heard a talk from a gynaecologist, I could not believe my ears at the amount of advanced cervical cancer that you have here. And when you realize that 80% of cancers can be recognized by visualizing the cervix, not even doing a smear or anything else, you realize that actually everyone could do a lot better and could help prevent this terrible disease. And it's dropping. The incidence in somewhere like the UK has dropped dramatically. So think about these things in your daily practice. You can make quite a difference. And so I would urge you all to take worries and symptoms very seriously. Treat the symptoms appropriately when they're related to estrogen loss, or not. Women come to your clinics because they're worried about something. And so you need to always try and deal with that worry, whether you use pharmacological agents or not. Undertake screening where you can, and just encourage a greater interest in midlife women. This was one of the things that struck me when I first came to India and to Sri Lanka and Bangladesh. Obviously, there's a huge concern with maternal mortality and young women. But I met so many inspirational women in midlife who really cared about others of their own age. And I feel that this is something that is really in keeping with what we've been hearing about Dr. Stya Paul. And I'm delighted to have been able to give this oration. And I would encourage you all who are interested in this area of midlife health to come to the next World Congress of the Menopause in Prague in 2016, where I hope many of your friends and colleagues will be present. And thank you very much indeed for your attention.